Pushing the Reset Button, a hot debriefing curriculum. I'm Dr. Megan Gillespie, and I'm presenting to you today my CORD Mini Fellowship in Wellness Leadership project, which focuses on a curriculum that I developed to help you become a more efficient and effective hot debriefing leader. We're going to go through a couple of different things, but of note, I want to let you know that we're going to be using a pre-made hot debriefing tool known as STOP5, which was created and generously provided with minor adaptations by Dr. Craig Walker et al. From the Emergency Department of the Royal Infirmary of Edinburgh and the Scottish Centre for Simulation and Clinical Human Factors. So, what does R.E.S.E.T stand for? Recognize the critical incident, emotional self-awareness, self-debrief, empathy towards others' emotions, team hot debrief. Before we get too far, though, into the R.E.S.E.T curriculum and mnemonic, let's go over some learning objectives for this presentation. First, we're going to define what a critical incident is. Then we're going to learn about the effects from repeat exposures to these critical incidents. We're going to differentiate two types of debriefing, discuss the benefits and barriers of hot debriefing, and then we're going to move forward and utilize the R.E.S.E.T mnemonic to be an effective and efficient hot debriefing facilitator. And we're going to explore the frameworks that R.E.S.E.T was based on, including Goleman's emotional intelligence theory and Mitchell's 7-step model for critical incident stress debriefing. We're going to learn about some hot debriefing tools that have been created thus far. And finally, we're going to go ahead and we're going to practice the adapted STOP5 Hot Debriefing Tool in conjunction with the R.E.S.E.T curriculum. So let's go ahead and get started. What are critical incidents? Critical incidents are encountered frequently while working in the acute care setting, such as the emergency department, and can be depicted by cardiopulmonary arrest, severe traumatic injuries, pediatric resuscitations, just for some examples. And while medical school has given you all that knowledge foundation and residency has given you all that training to clinically apply that knowledge foundation, I've experienced firsthand and also through review of the literature that there's not any formal curriculum on how to best manage yourself and your team immediately after critical incidents. After critical incidents, the team can feel a variety of emotions, from frustrated to defeated to sad to concerned, just to name a few. And it can often be difficult for emergency medicine providers to reset emotionally after these intense critical incidents and resume their routine clinical responsibilities. Repeat exposures to critical incidents can cause things like compassion fatigue, second victim syndrome, and burnout. All things that we're looking to avoid so that we can continue to enjoy our careers that we picked in the acute care setting, as well as provide the best patient care that we can. So, what are we going to do about it? Insert debriefing. Debriefing is a facilitated, reflective participant discussion to analyze events in a supportive group setting. Let's review two types of debriefing. There's hot debriefing, which we're going to primarily focus on. This occurs minutes to hours after the critical incident. All team members directly involved in the patient care or critical incident can participate. It's typically shorter in duration, ideally less than 10 minutes, which is why it makes it very feasible to incorporate into our daily emergency medicine practice. The other type of debriefing is cold debriefing. This typically occurs days to weeks after the critical incident. It can involve participants besides the team members that were directly there for the critical incident, and it's oftentimes longer in duration, making it harder to ensure that it happens. So let's focus in on hot debriefing. What are some of the benefits that hot debriefing provides? Well, it provides opportunities to learn, as well as improve operational policies. It's found to improve patient outcomes. Hot debriefing can increase team dynamics and morale, and it can provide some stress relief from these repeat exposures to critical incidents. A review of the literature shows that only less than or equal to 25% of resuscitations are currently debriefed. If you're anything like me, you're kind of like, what? Why? Why so few? Let's go over some of the barriers to hot debriefing. There are operational pressures to resume routine clinical responsibilities. There's limitations on participant availability. There's a culture of clinicians that being vulnerable in discussing emotions with colleagues can be perceived as a weakness. There's a lack of standardized hot debriefing procedures. And the most commonly cited barrier for hot debriefing implementation is insufficient training in how to be an effective and efficient hot debriefing facilitator. And that's what we're going to focus on today with the R.E.S.E.T curriculum. So it's finally time to circle back to pushing the reset button, our hot debriefing curriculum. And hopefully the next time you find yourself in a situation where you need to reset, hopefully this mnemonic can help you and it can guide you in how to be an effective and efficient hot debriefing leader. Let's review. What does the R.E.S.E.T mnemonic stand for again? First, recognize the critical incident. Emotional self-awareness, self-debrief, empathy towards others' emotions, and finally, team hot debrief. Let's break these down step by step. Recognizing the critical incident. As we stated before, critical incidents can include cardiopulmonary arrest, severe traumatic injuries, or pediatric resuscitations, just as a couple of examples. Moving into kind of the meat of the R.E.S.E.T mnemonic, let's further understand why these letters are here. What do we need emotional self-awareness for, self-debriefing, and empathy towards others' emotions in order to be an effective and efficient hot debriefing leader? Well, the R.E.S.E.T mnemonic was based on two main frameworks: Goleman's emotional intelligence theory and Mitchell's 7-step model for critical incident stress debriefing. Let's review Goleman's emotional intelligence theory. When you do reading on how to be an exceptional leader, emotional intelligence frequently comes up. Emotional intelligence, or the key to exceptional leadership, is defined as the ability to understand, use, and manage your own emotions in a positive way to relieve stress, communicate effectively, empathize with others, overcome challenges, and diffuse conflict. And it's based on the 4 domains of self-awareness, self-management, social awareness, and relationship management. We're going to go into these, but before we do, let's look at some of the benefits of being in tune with your emotional intelligence or working to improve it. You'll have increased leadership ability, increased personal well-being, increased team performance, improved decision-making, and decreased occupational stress. Now, let's circle back and talk about those 4 domains again: self-awareness, self-management, social awareness, and relationship management. As you can see, there's kind of some examples as to what falls into each box and how they interplay with each other. I highly, highly recommend, if you have the chance, to read Daniel Goleman's book, Emotional Intelligence: Why It Can Matter More Than IQ. But this is the framework that provided some of those middle letters of the R.E.S.E.T mnemonic that stand for emotional self-awareness, self-debrief, and empathy towards others' emotions. Let's talk a little bit more about the second framework that really went into the basis of the R.E.S.E.T mnemonic for being an effective and efficient hot debriefing leader: Mitchell's 7-step model for critical incident stress debriefing. Jeffrey T. Mitchell developed this 7-step model for critical incident stress debriefing back in 1983, actually, while he was working as a firefighter and paramedic, and it has since become part of the comprehensive, systematic integrated and multi-component crisis intervention program called Critical Incident Stress Management. Critical Incident Stress Debriefing consists of a 7-step debriefing process facilitated by a trained facilitator within 24 hours to a couple of weeks after the critical incidents. The main goals of critical incident stress debriefing is to mitigate the effects of critical incidents, facilitate a normal recovery process in persons who are otherwise mentally healthy, and screen for those who may need additional support or assistance. Let's go through these 7 steps. Step 1, Introduction. This is where the facilitators group are going to introduce themselves. You're going to discuss the purpose and the ground rules. Basically, you're setting the tone of the session. Step 2 is Facts. This is where everyone's going to have a brief factual overview of events, and this is going to initiate participation and discussion from all members. 3, Thoughts. This step transitions from the cognitive domain towards the affective domain, and it prompts participants for further discussion about their first thought after the critical incident. Step 4, Reactions. This is the heart of critical incident stress debriefing. This is where they focus on the impact on the participants after the critical incident. Step 5, Symptoms. The facilitator is going to ask what cognitive, physical, emotional, and behavioral symptoms participants have been experiencing since the event, and they're going to know that themes of common symptoms associated with exposure to traumatic events will be expressed during this stage. Step 6, Teaching. The facilitator will normalize the symptoms brought up by participants and provide explanation of participants' reactions. This is going to provide some stress management information that participants can incorporate into their own lives. Step 7, Re-entry. Final explanations, action directives, guidance, and thoughts. Let's take a look at Mitchell's 7-step model for critical incident stress debriefing in graphical form. This really highlights and hones in on the fact that you have to be empathetic towards others' emotions, which is a critical part of the R.E.S.E.T mnemonic. Now that we've talked about the framework of Goleman's emotional intelligence theory and Mitchell's 7-step model for critical incident stress debriefing, hopefully you can understand where all these letters came from: emotional self-awareness, self-debriefing, and empathy towards others' emotions. That leaves us with only one letter left of the R.E.S.E.T mnemonic. T for Team Hot Debrief. STOP5 Minutes is a hot debriefing tool that was created by Dr. Craig Walker, Laura McGregor, Cameron Taylor, and Sarah Robinson at the Emergency Department for the Royal Infirmary of Edinburgh and the Scottish Centre for Simulation and Clinical Human Factors. This hot debriefing tool provides a script and prompts providers to stop for 5 minutes after a critical incident to perform a hot debrief. As you can see in the first part of the script, they kind of thank the team and ask if everyone is okay. If yes, they move forward and they state some ground rules, which establishes that this is a psychologically safe area to share thoughts during the hot debriefing process. As you can see, the rules that they state are that they're going to have a 5-minute team debrief, putting a time frame on the discussion. They say the purpose is to improve the quality of patient care. It is not a blaming session. Your participation is welcomed but not compulsory. And all information discussed during this debrief is confidential. The STOP5 Hot Debriefing Tool then moves into 4 different prompts for the team to discuss briefly. First, they summarize the case. Then they talk about things that went well. Then they talk about opportunities to improve. And finally, they close with points to action and responsibilities. Dr. Craig Walker et al. Studied the results of the implementation of their STOP5 Hot Debriefing Tool, and they found that respondents reported improved staff morale, team cohesion, improved care for future patients, that it promoted a culture of learning and patient safety and quality improvement. They also noted that there were 10 process and equipment changes that resulted directly from the STOP5 Hot Debriefing Tool over a 12-month period. With their study demonstrating that the STOP5 Hot Debriefing Tool is effective, It was modified and adapted slightly to include the R.E.S.E.T mnemonic at the top and had the colors changed so that posters could be printed as well as ID badges for residents and staff to utilize to incorporate hot debriefing more regularly into our emergency medicine practice. This is an example of ID badges that were created to help residents and staff remember what the R.E.S.E.T mnemonic stands for, as well as have immediate access to the STOP5 Hot Debriefing Tool. Again, here's the same Stop for 5 minutes hot debrief tool that was utilized for departmental posters. As you can see, a QR code was embedded on this poster so that staff could easily access the prompts and record them in a space where administration could review to see if any actions had to be taken. So let's go ahead and review exactly what shows up when you use your smartphone to scan this QR code on the posters or on the ID badge cards. Scanning this QR code is going to bring up a Google form that's going to have the Stop 5 and R.E.S.E.T mnemonic on it. It's going to go through the R.E.S.E.T mnemonic so that you can get yourself in the mental space so that you can be an effective and efficient hot debriefing leader. It goes through the script that's preset. You can modify this if you want, but to kind of keep you on task. And then it actually, as you continue scrolling all the way down to the bottom after that repeat exposure to that poster that we've been seeing, it has spots for you to go ahead and click where you can summarize the case briefly. Was it a cardiopulmonary arrest, a trauma alert, a pediatric resuscitation, or other? It has a free type-in space where you can type in things that went well, a free type-in space for opportunities to improve. And then on the last point, there's points to follow up, and you want to make sure that you assign somebody for these things. But this is where you can kind of check off if a cold debrief is desired, if there were equipment issues, or if there were other operational or policy issues or other things that needed to be followed up. All right, you guys made it. Let's go through a summary of pushing the reset button hot debriefing curriculum. We talked about some learning objectives in the beginning, and just to summarize, we defined critical incidents to include cardiopulmonary arrest, trauma alerts, pediatric resuscitations, amongst others. We talked about repeat exposure to critical incidents can cause compassion fatigue, second victim syndrome, and burnout. We talked about the 2 types of debriefing, including hot and cold debriefs. The benefits of hot debriefing include opportunities to learn, improve patient outcomes, increase team dynamics and morale, and provide stress relief. The R.E.S.E.T mnemonic can help you be an effective and efficient hot debriefing leader. The R.E.S.E.T mnemonic was based on the frameworks of Goleman's emotional intelligence theory and Mitchell's 7-step model for critical incident stress debriefing. And as a review, we're going to go over what the R.E.S.E.T mnemonic stands for. Don't forget that R is to recognize the critical incident, E, emotional self-awareness, S, self-debrief, E, empathy towards others' emotions, T, team hot debrief. Using this R.E.S.E.T mnemonic in conjunction with the slightly modified STOP5 Hot Debrief Tool, I have no doubt that you're going to be a successful hot debriefing leader and make a difference not only for yourself, but also for your team. Thank you so much for your time and attention. These were some of the image credits that were used in this presentation, as well as some references for some additional reading. I wanted to give a special thank you to Dr. Raman Tabatabai, Dr. Muhammad Musa, and Dr. Adam Kellogg, who were my mentors for the Cord Mini Fellowship in Wellness Leadership, to Dr. Christine Strahan and Dr. L.A. Alvarez for leading the Mini Fellowship in Wellness Leadership, as well as to my program directors, Dr. Scott Plasner and Dr. Rob Danoff, along with Dr. Kimberly Groen and my other faculty for championing my passion for wellness, and to my departmental leadership, Dr. Gerald Wydrow, Dr. John Schroeder, Dr. Cynthia Fusco, Donna Titus, Tammy Graff, and Karen Zelt for your support in implementing this project.